We often take the simple act of breathing for granted, but the air we breathe, especially in shared spaces, can harbor invisible threats to our health. Proper ventilation is not just about comfort, it's a critical public health intervention. It's about ensuring that the air we share is clean, fresh, and free from harmful pathogens. This is particularly crucial in community settings where people congregate, such as schools, hospitals, and workplaces. Think of ventilation as the lungs of a building, constantly refreshing the air and removing contaminants. Just as our lungs expel carbon dioxide and inhale oxygen, ventilation systems remove stale air and replace it with cleaner air from outside. This process dilutes the concentration of airborne pathogens, reducing the risk of transmission. Especially in crowded indoor environments, this constant air exchange is paramount. The importance of ventilation in safeguarding public health is more evident than ever. The COVID-19 pandemic highlighted how quickly airborne viruses can spread in poorly ventilated spaces. But even before the pandemic, we knew that inadequate ventilation contributes to the spread of diseases like tuberculosis, influenza, and the common cold. By prioritizing ventilation in community spaces, we can significantly reduce the burden of these preventable illnesses. There are two primary types of ventilation: natural and mechanical. Natural ventilation relies on opening windows, doors, and vents to allow fresh air to circulate. This method is cost-effective and sustainable, especially in climates where opening windows is feasible for a significant portion of the year. It leverages the natural forces of wind and thermal buoyancy to drive air exchange. Mechanical ventilation, on the other hand, uses fans and ductwork to move air. This method offers greater control over airflow and filtration, making it suitable for larger buildings and areas with poor natural ventilation. Hospitals, for example, rely heavily on mechanical ventilation systems equipped with HEPA filters to maintain sterile environments. Designing effective ventilation systems for community spaces requires careful consideration of the building's layout, occupancy levels, and local climate. In schools, for instance, ventilation systems should be designed to provide adequate fresh air to classrooms, even during peak occupancy periods. Similarly, hospitals need to ensure negative pressure rooms with dedicated ventilation systems to isolate patients with airborne infections. The link between poor ventilation and outbreaks of respiratory illnesses is well established. Studies have shown that inadequate ventilation can significantly increase the risk of airborne transmission of diseases like measles, tuberculosis, and influenza. For instance, a study published in the American Journal of Respiratory and Critical Care Medicine found that improving ventilation in hospitals reduced the incidence of tuberculosis transmission by up to 90%. One compelling case study that underscores the importance of ventilation comes from a high school in Tennessee. In 1977, an outbreak of a mysterious respiratory illness affected over 100 students and staff. The culprit was eventually identified as Legionnaire's disease, a severe form of pneumonia caused by bacteria that thrive in stagnant water. Investigations revealed that the school's air conditioning system was heavily contaminated with the bacteria, and poor ventilation allowed it to spread rapidly throughout the building. This outbreak served as a stark reminder of the potential consequences of neglecting ventilation in public buildings. It led to significant changes in building codes and public health regulations, emphasizing the importance of proper ventilation and regular maintenance of HVAC systems. Improving ventilation in community settings, particularly in resource-constrained areas, requires a multi-pronged approach involving policymakers, community leaders, and health professionals. One key strategy is to incorporate ventilation considerations into building codes and regulations. This includes mandating minimum ventilation rates, promoting natural ventilation strategies where feasible, and ensuring regular inspection and maintenance of ventilation systems. Community education campaigns can raise awareness about the importance of ventilation and encourage individuals to take simple steps to improve air quality in their homes and workplaces. These campaigns can emphasize the benefits of opening windows, using exhaust fans while cooking, and avoiding overcrowding in indoor spaces. They can also dispel myths about drafts and promote the use of simple, cost-effective ventilation solutions. Health professionals play a crucial role in advocating for better ventilation in healthcare facilities and community settings. They can work with architects and engineers to ensure that new buildings are designed with adequate ventilation and advocate for the retrofitting of older buildings to improve air quality. Furthermore, they can educate patients and community members about the importance of ventilation in preventing the spread of infectious diseases. By investing in proper ventilation, we are investing in a healthier, more resilient future. It's a cost-effective and sustainable way to reduce the burden of respiratory illnesses, improve productivity, and create healthier environments for everyone. Just as we prioritize clean water and sanitation, we must recognize ventilation as a fundamental pillar of public health.